Hello and welcome to another episode of the Power Up micro lecture video series. Today we're going to be talking about cryotherapy in physical therapy, and you can view this on YouTube or via your Microsoft OneNote or Teams. Why do we call them power ups? Well, basically these will reinforce the learning that you do in class, on placement and in your independent study. Which reminds me, before we go any further, these are the accompanying pre-reads or reading materials that will help support your understanding of the content of this quick lecture. So we're going to talk about cryotherapy and physical therapy, but we're only talking about acute soft tissue trauma. We are not talking about ice baths, immersion. We're not talking about cryo chambers, and we're certainly not talking about eating ice creams while doing the London Marathon. We are, as you can see, talking about acute soft tissue trauma today. So before we go on with ice, let's revisit what we're thinking about here. So these kind of two acronyms, you've got police in the bottom left corner there, protection, optimal loading, ice compression and elevation. So we're only focusing on the ice. Just to make you aware that in a recent British Journal of Sports Medicine editorial, there was a recommendation for the acronym Peace and Love, and you'll notice that ice isn't included in that, and perhaps we'll find out a little bit more about why within this session. So in order to understand why we're using ice, we need to think about what's happening when we've just got injured. So we are going to be talking a little bit about this inflammatory phase of soft tissue healing. So we've got Adam Jamili there, just strained his hamstring. So at the point of that damage to the tissue, we've got lots of stuff going on. We've got an initial vasoconstriction, we've got some quickly followed by some vasodilation, we've got lots of kind of chemical and vasoactive factors being released. And this is causing a wealth of changes within the tissue. We're getting the beginnings of a blood clot. We're also getting activation of white blood cells that are going to be rushing towards this site. We've got changes in diffusion, we've got changes in osmosis, we've got increased blood flow. All these things will cause a secondary cell death, because the more swelling we have, the more kind of secondary tissue death we get around the initial focal site. So in essence, to really sort of summarise this inflammatory issue going on when we've got a soft tissue injury, we've got a vasoactive and chemotactic factor release. These cause vasodilation. This directly increases blood flow, so obviously that's going to make the area hotter, it's going to discolour it, and it's going to lead it to swelling. We're also going to have an increased permeability, so we're going to have increased edema in the area, and as we said, these white blood cells emigrating to the area to make it swell up as well. They've got to do a very important job, but it's going to cause swelling. Now all these factors will lead, or the swelling and the direct damage from the initial injury will cause nociception, so warning messages being relayed up to the spine. And of course our final cardinal sign of inflammation is a change in function, and usually we see that if it's a lower limb injury in something like a limp or a reduced desire to use that body part. But we also might be thinking about functions of the mind as well. So in this phase where we've got inflammation, we've just had an injury present to us, what are our objectives? Well, you can see them listed there, but we're talking about ice today. So we're going to be using ice in theory to help control inflammation and maybe have an effect on the mind a little bit, or the emotions. But first of all, you'll notice that I say control inflammation. I do not say limit inflammation or reduce it or get rid of it, because it's a really important part of our natural recovery process. Think of it like this. If you're having a house party, if you had no house party at all, you wouldn't have any fun. You need a house party to have fun. However, if everybody goes crazy and starts wrecking the furniture, the party gets out of hand, you're not going to be able to clean up very quickly or very well afterwards. It's going to get out of hand. So really what we're doing with our inflammation is we are ensuring it's a good facilitated process, a good house party. We're not going to let people stain the carpet or break the furniture. So how do we do that with ice? Well, there's various applications. You can see here in the top left, you've got the game ready machine. Lots of nice levers, buttons, flashing lights, makes a nice noise, combines it with intermittent compression, loads of different settings. Hey, this is really going to impress the athletes when you put this on them. But it's mostly about cooling down the injured side. And you can put it on knees, ankles, shoulders, etc. Bottom right here, you've got the cryo cuff. So when I graduated 20 years ago, this was the fanciest bit of equipment you could have. And again, it gives you compression that's not intermittent, but it's going to make you very, very cold. Or you've got your wet ice packs in the top right, your reusable cold packs that you can chuck in the freezer. You've got standard ice cubes. See a nice cloth barrier there. That might be important, as we'll see later on. And you've got your instant ice packs and your pain relief cold sprays. Both of those not going to penetrate as deeply. They're going to wear off pretty quickly. They're going to get warm. So we've got lots of different ways we can use cryotherapy in sports injuries. How are we meant to apply it? Well, the guidance is generally this. Use it whenever you want, really, but during inflammation. So often you'll read in the guidelines 0 to 72 hours after inflammation, but it depends on those cardinal signs that you assess clinically. How long are we going to use it? 10 to 20 minutes. It depends on the body part, doesn't it? Okay, and the size of that part, how well insulated it is in terms of adipose tissue and muscle. How often? Well, anything between about an hour and a half and every 4 hours, waking hours. Intensity, it's got to be tolerable. Okay, we need to be checking that we're not causing any tissue damage or any pain. So never directly on the skin if it's ice. And we haven't included here ice massage, but that might be something that a skilled practitioner might, if they have the time, might apply. So how does it work? Well, there are two sort of theories that, are they going to have any effect? We're not really sure, but let's say we do get a reflex. Some studies have shown some reflex muscle stiffness. So an increased muscle stiffness with the application of ice. This may mean that I move the offending or the injured part less, and therefore I'm going to get less secondary damage. I'm not going to irritate that inflammatory house party, right? The other one is a decrease in tissue temperature. Obviously, this is the most obvious one people say. We're going to reduce metabolism around the area, and that's going to reduce or limit the severity of that inflammation. Again, we're going to have a nice house party, not a really raucous one. It needs to be about 5 to 15 degrees at the site of the injury. So whether this actually happens at a deep tissue level is yet to be proven and doesn't look like it would happen. So why are we using it? Why is there a therapeutic effect? Well, the two main reasons are related to pain, really. We have, with a temperature reduction of 10 to 15 degrees, we do see a decrease in nerve conduction velocity. Therefore, these nociceptive signals are going to travel more slowly to my spinal cord if I'm using ice. The application of ice itself is obviously going to affect our pain gate, and these might lead to decreased nociception signals going to our spinal cord, which is less to reach the higher central nervous system. And then linked in with that, really, we've got these coping effectors. If I'm using ice, I am doing something to help myself. I have some form of control. I also will be initiating these contextual factors that might optimize my opioid system to reduce my pain experience via descending modulation. So affecting the pain experience. And of course, there's no evidence out there that ice will decrease swelling, but if it allows me to do pain-free isometric squeezes or some very, very pain-free, safe, active mobility movements, which will help milk some of that swelling out through muscle contraction, that might have a knock-on effect of reducing swelling. So it might be a good thing. So in essence, really, to kind of summarise, why is ice a therapeutic modality for sports injuries? Well, if we look at this biopsychosocial paradigm, this model, okay, you've got three separate entities there: psychological, social, and biological. They do not have a delineation between them. They overlap hugely, but just for the sake of understanding it, we kind of identify the three sections there. So first of all, if I'm icing my fresh injury, I'm not doing much else. I'm very unlikely to be moving around and making it worse. Therefore, that inflammatory process, that clotting, that platelets aggregation, everything else going on in my vaso and chemotactic factors release, that will all be allowed to do what it wants, but it won't be aggravated or increased. It's a good house party. We've also got, as we said, our pain gate theory. Okay, by activating my thermoreceptors, my larger myelinated nerve fibers, they're going to activate an inhibitory neuron, interneuron, in the dorsal horn of the spinal cord, and we are going to have a reduction in nociceptive signals. The pain is going to be reduced, perhaps, as it's perceived in the brain, higher centres. Similarly, we also have our descending pain suppression system, our periaqueductal grey matter, our rostroventral medulla. So the context of applying ice, being cared for, caring for myself, possibly even some placebo in there. We can never get rid of that, right? They're all going to harness my kind of endogenous opioid system to have an impact on my pain perception. And then, of course, as we alluded to, it's something I can do myself, and I'm getting help from somebody else. They are hugely important therapeutic factors, and perhaps we can't do too much else with an acute injury. So important. Now, just to note that when we use ice, there's a couple of precautions and considerations to think about. Firstly, we know that we would have, when we apply ice, there is a decreased ability to think about how we position our joints. Our feedback system, so our reactions and our responses, so our activation of our muscles is reduced. The timing is reduced, and it's less optimized. And this has implications, because if I want to ice an athlete and send them back out to play, then maybe their response and the reaction is going to be less optimized. We've also got delayed, as we said, so my initiation of kind of reflexes and protection of my joints might be affected. We've also got to be careful about burns, so ice burns. We alluded earlier to having a cloth barrier when we're using ice, making regular checks every 5 to 10 minutes to see if there's any problems there. And that leads us into our contraindications, because if I've got a peripheral neuropathy, I'm perhaps not going to be able to detect when my superficial tissues are becoming damaged. Very, very important. If I'm unable to follow instructions, is it because of age? Is it because of psychological issues? Is it because of being under the influence of alcohol or drugs? These would preclude me using ice or advising ice. If I have cold allergies or a hyper response to cold, so cold urticaria, that would preclude me. Certain circulatory and vascular conditions, such as Raynaud's disease, cryoglobulinemia, hypertension, etc. And of course, broken skin or superficial nerves. We want to stay away from those. So, to summarise, there's insufficient evidence to determine the relative effectiveness of ice, but treatment decisions must be based on an individual basis, or made on an individual basis. Although a definitive conclusion on the efficacy of cryotherapy cannot be drawn, the general consensus is to continue to use it in the acute sports injury phase, during this inflammatory phase. Be careful when you use it, follow the guidelines, and please do read through the accompanying reading that I alluded to at the start, particularly the cryotherapy guidelines from Physiopedia. It's number 4 on that first pre-reading. Thank you for listening, and we'll see you soon on the next episode of the Connecting Me to You Power Up micro lecture video series. If you've got any feedback or any comments, please do tweet me at Cold Therapy Ed. Bye for now.